A few years ago, many of us would have called it the stuff of science fiction. But right now, millions of people around the world are seeking mental health therapy from an AI chatbot.
ChatGPT is used increasingly for people asking questions about health.
In the UK, AI-powered psychology is already part of the National Health Service.
Meet Limbic, your personal therapy assistant.
When I see a new AI tool, what makes me trust it or not trust it is questions like, is it going to work in our patient population? So our acuity mix, our comorbidities, demographics, our data quality issues, does it fit into how we actually work?
The concierge robot at Baptist Care brightens the day for residents like Anne Coyer. The coming generation of robots can do a lot more than push laundry baskets. AI programs can already converse with people, and in aged care, there's a demand for interaction.
Sensors and cameras track Dieter's every move in this smart intensive care unit, from vital signs to facial expressions and everything in between. More than 350 gigabytes of information per patient goes into a central computer, where artificial intelligence then processes the data.
AI never has the full context, and in health, advice depends on much more than the information entered into a system.
The AI boom really hit healthcare in the last 5 years. New ways to treat diseases, new ways to diagnose diseases.
The Gen AI boom is assisting doctors in more advanced ways, but both clinicians and patients are questioning the risks these new technologies may bring with them.
I'm also concerned about privacy and where do my questions, where does the information that I'm asking about health go? How might it escape the systems down the track, and what might that mean?
I want transparency. I think everyone involved needs to be clear about where any data collected goes, who controls it, and how it can be deleted.
Machines are getting smarter, and now artificial intelligence is being applied to hearing aids. A device new to the market in Australia tracks a user's overall health and can even detect if they suffer a fall.
There's an accelerometer and a gyroscope, and they're monitoring the head movement and the patient's movement in space. So we're looking for a specific pattern or algorithm, what a fall looks like, and then it uses the cloud computing to send alerts or text messages to the loved ones that they've placed in the app.
I think you are wonderful.
How can we create technology that can help people really meaningfully contribute with all sorts of abilities?
In the training lab, we really focus on restoring voice to people that have lost it due to conditions like stroke or ALS.
Do not make me laugh.
Specialists across Australia are adopting artificial intelligence to help them focus more on their patients instead of paperwork.
In the consult room is a virtual assistant. The AI software listens, converting only relevant parts of the conversation into medical notes, and within seconds, a letter is prepared for the patient's GP.
If a doctor or a vet is using AI note-taking in a session, then I know that they will need to be checking the output. Based on what I've seen in terms of AI summarisation, it's not always accurate.
I don't trust that it won't just make things up. AI might be good, it can save time, but it definitely needs a lot of human oversight.
In Australia, many psychologists are optimistic about AI, but say the government needs to step in with some regulation around ethical standards.
Our research warns of what we would call pseudo-intimacy. The interaction really does lack that emotional reciprocity. It might give advice that feels helpful in the moment, but it fails to meet psychological needs and may even reinforce harmful beliefs.
I trust AI in health with verifiable factual information. I do not trust AI with opinion.
In terms of health-seeking information, it again depends on how clear, how transparent the source information is. There will be times that I'm happy to use AI depending on what the source information is. So AI functionality within tools that are grounded in corpuses like OpenAlex versus Gemini or ChatGPT, I'm going to be far less inclined to trust what AI tells me at face value.